This is John Miller. I'm in Second Life on Evergreen Island, Evergreen 1, near the orientation area. And I'm going to do a brief Nursing 211 Unit 3 review. And these slides are also up at Google Sites. And to the left of this is actually a video within Second Life you can watch, or you can watch it from Google Sites, which will be up on YouTube. So let's just go through a few of the slides here. The first things to really know about are the heart sounds, the medical problems associated with them, as well as their location and whether they're heard better with the bell or diaphragm. Coronary artery disease and angina assessment, the types of angina, and the differences in symptoms between elderly women and diabetic versus the rest of the population. And this is also seen, of course, in MI too. Treatment for coronary artery disease and angina, angioplasty with stents, the activity, diet, nursing care with that particular procedure, diet, examples, foods to avoid, medications for coronary artery disease and angina, and exercise duration and frequency. Myocardial infarction assessment, differences in MI versus angina, the EKG changes in general, the STEMI versus non-STEMI types of MI. Left ventricular failure leading to decreased cardiac output, signs and symptoms. Myocardial infarction treatment, STEMI versus non-STEMI, medication classifications and examples. The rehab phase 1 activities and phase 2 discharge teaching, and finally the complications, ventricular dysrhythmias, congestive heart failure, heart block, and others. So we're going to walk over and take a look at some heart block in terms of assessment, and of course you also need to know treatment, the medication examples, and various aspects of pacemakers such as modes of pacing, insertion, and interference. We'll come back to this. Now these EKGs, the green ones with the blue parts, they're all heart blocks, so see if you can figure them out. And the hint is the blue part is actually the PR interval, so take a look at that. We also have some strips, several strips here that are rhythms that you might want to see if you can figure out how they're treated and what they are, of course. I've got 1, 2, 3, 4, 5, kind of the lighter pink color ones that I want you to focus on for this unit. If we go over to here, we have some of the ACLS guidelines. And this particular one is a bradycardia, so any kind of bradycardia, it doesn't matter whether it's sinus or otherwise, and it kind of gives you an idea of what to do. And you don't have to memorize these are just helpful to sort of put everything together, and some of the medications we've talked about, of course, are in here. There's a mnemonic for bradycardia, and this is kind of hard to see, but if you click on the page, each of these items will take you out to the real web page. Here's tachycardia with pulse. So for example, V-tach with pulse, and then what to do on that. Here's a mnemonic for tachycardia, and kind of helps you remember. Again, these web pages, real web pages, are actually, by clicking on this this sign, you can go right to them. This is a pulseless arrest algorithm, and so take a look at this. Again, this is a review. You don't have to memorize these. A mnemonic for asystole, a mnemonic for VT pulseless VFib, mnemonic for cardioversion. As I walk around, I just sort of lost my camera angle there, and we'll zoom up here. And this is a acute coronary syndrome, which is basically another way of saying somebody with like an MI. So you have a chest discomfort, or you may have what's the atypical or actually absent chest pain kinds of assessment. But here are all the treatments and so forth based on the Advanced Cardiac Life Support Guidelines and STEMI versus non-STEMI. So anyway, those are some things you can take a look at here. I'm going to fly back over here. There is a quiz right here, and if you click on it, it'll actually, and when I click it turns it off, but as I re-clicked on it, it gives me a question over on the left, and if you type in the answer and get it right, you win 5 Lindens. And you can take Lindens and actually buy things within Second Life. Over here I've moved some of the medications to different places. So I've moved Lanoxin, for example, which is Lanoxin is digoxin. I've moved it up near the AV node because in heart block, of course, it can cause heart block, and we want, of course, get that medication DC'd in the more serious forms of heart block. Procainamide works more on the ventricles, so it's more in the ventricular area. So anyway, you can move these around by right-clicking, editing, and then left-click on the arrow, and you can drag it around. So play with these if you want, and you have to look up the answer because it doesn't supply it for you here. Although if you click on the sign, it does give you, it will give you a link here when you click on it. So those are some things you do with the medications. So we just talked about heart block, and going to move in a little closer here and pan up. So let's go ahead and ventricular dysrhythmias, ventricular fibrillation, tachycardia, and standstill. Be sure you know the medications and other treatments for those particular problems. Congestive heart failure, be sure you know the assessment for the left versus right, as well as the treatment for left versus right congestive heart failure with respect to medications and other treatments. Heart surgery, be sure you know about the valves and the differences between mechanical versus biologic type valve, heart valve tissue replacements. So, and that concludes our review. If you have any questions, be sure and get a hold of me. Thank you.